Good evening. I'm Hannah Jans, and tonight I will inform you on how triage works during a mass casualty incident. Imagine arriving on a scene of a major accident or disaster where there are multiple injured people but not enough resources to treat them all at once. In this moment, healthcare providers must quickly decide who needs immediate care and who can wait. Through my medical training, I have learned how quickly these decisions must occur when time and resources are limited. Triage is conducted by rapidly assessing patients, assigning priority levels, and guiding treatment decisions. First, I will explain how patients are initially assessed. This is typically done through an algorithm such as START triage, which stands for Simple Triage, Rapid Treatment. This process begins when a provider assesses if a patient can walk. If a patient can walk, they are categorized as a minor because they are stable enough to wait for care. If a patient cannot walk, a provider will then assess their breathing. If a patient is not breathing, their airway may be repositioned. However, if respirations do not resume, the patient will be categorized as expectant. If a patient is breathing, the provider will move on to circulation by assessing their pulse or capillary refill. Finally, a provider will evaluate a patient's mental status by determining if they can follow simple commands. After the initial assessment, patients are given a priority level. These priority levels are typically color-coded: red for immediate care, yellow for delayed treatment, green for walking wounded or minor injuries, and black for expectant or deceased. This color-coded system allows providers to easily recognize who needs immediate care and who can wait. Finally, triage helps guide treatment decisions. During a mass casualty event, resources such as time, personnel, and medical supplies are limited. Because of this, providers focus on treating as many patients as possible rather than one individual. It's also important to recognize that triage is not a one-time decision. It's a dynamic process. Patients are continuously reassessed, and their priority levels may change if their condition worsens or improves. Triage is a critical process during a mass casualty incident, which requires high stakes and effective decision making. It works by assessing patients quickly, assigning priority levels, and guiding treatment decisions for maximal survival. Understanding triage helps us appreciate how medical providers make high stakes decisions under a lot of pressure. Thank you.